Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, the Language of Medicine, 12th edition by Davy Allen Chabner. And we have moved on. Here it is, week 2 into chapter 3, which is all about suffixes. Our chapter goals include defining new suffixes and reviewing those presented in previous chapters, gaining practice in word analysis by using these suffixes, with combining forms to build and understand terms. And remember, our combining forms are the root plus the combining vowel. Identify the functions and different types of blood cells in the body. So let's get going. Some combining forms that we're going to learn about this week include abdomino, acro, acuo, adeno or adeno, more likely adeno in most cases, adipo, amnio, angio, arterio, arthro, and axillo. So you can see all the meanings of each of those. Some additional ones, bio, blepharo, and watch out for that PH there, blepharo, broncho, carcino, cardio, chemo, chondro, chrono, colo, and cysto. Encephalo, erythro, hemo, hepato, hydro, inguino, ischo, laparo, and watch out for ischo, because you might think it's the same thing as ischio, and it's not, so watch out for that. Laparo, anytime you see laparo like this, you're thinking abdomen, abdominal wall, like a laparoscopy. It's going into that abdomen and looking around. Laryngo, and remember, anytime you have that X, it's going to switch to a G. And leuco. Lympho, mammo, masto, and watch out, there's two different ones for breast, mammo and masto. Morpho, muco, myo, myelo, necro, nephro, neuro. Neutro, nucleo, ophthalmo, we've had that one before because you got to watch out for that PHTHALM. Osteo, odo, patho, peritoneo, phago, phlebo, like a phlebotomist, phlebo. Plazo or plazo. Pleuro, pneumono, pulmono, and notice there's two different ones there for lungs, so watch out for that. Radio, recto, reno, rhino, sarco, spleno, staphylo. Strepto, thoraco, thrombo, tonsillo, tracheo, and veno. And I want to point this out. Staph, have you ever heard of someone having a staph infection? It means their bacteria is in clusters versus someone who has a strep throat infection, their bacteria is in twisted chains. So you might want to keep that in mind. All right, some suffixes that we're going to cover this week are algia, seal, synthesis, coccus, and again, staphylococcus. We learned about staph up here, clusters, coccus, berry-shaped bacterium, versus streptococcus, or cocci. And streptococcus means twisted chain, berry-shaped bacterium. Site is cell. Dynia, ectomy, emia, genesis, gram. Graph, graphy, itis, logi, or logi, lysis. Malacia, megaly, oma, opsiosis. Pathy, piña, phobia, plasia, plasty. Ptosis, remember we dropped that P, ptosis, rhea, and watch out for the double RH. Sclerosis, scope, scopy or scopy, stasis. Stomy, therapy, tomy, trophy. So quick quiz, which term, which term means fear of heights? Fear of heights. Well, we have phobia, which we know means fear. Now you're going to have to figure out which one of those means heights. All right, suffixes. ER or EA or EA, ist, ol, eul. Look at ol and eul. They both mean little and small, but you're going to have to know which one goes where. And us and y. Now here's all those pertaining to's. There are so many that mean pertaining to. Ac and eac, al, r, eel, genic. And some more. Ick and ickle, oid, os, us, and tick. So let's look at some combining forms plus suffixes. If you have arthritis, you have inflammation of the joint. If you have blepharoptosis, you have drooping of the eyelid. If you have ischemia, you have abnormal blood flow, because emia is blood, and ish, you don't have that. It's loss, less, that type of thing. Osteogenic. Genic means producing. Osteo is bone. So osteogenic means it was grown or produced or created out of bone tissue or out of bone. Staphylococci. That is the berry-shaped bacteria that grow in clusters versus the bacteria-shaped bacteria that grow in those twisted chains, which would be staphylococci. All right, so let's talk about what is a hernia. A hernia is where you have an organ or muscle wall of an organ that protrudes through the cavity that normally contains it. And here they show you a cystocele, where you have the urinary bladder pressing through. And then here they show you where there's a rectocele where it's pushing through, where this part is pushing through. It should normally be contained and it's not. So that's what a hernia is. And typically hernias are in inguinal areas, although they can be in the umbilical area as well. So quick quiz, a rectocele is what? Rectocele. Well, we know it's that protrusion in the rectum, so hopefully that will help you. All right, so staph and strep. Let's talk about those. They either grow in chains or clusters. And then blood cells. There are red blood cells, white blood cells, and clotting cells. So you have erythrocytes, that erythro means red, leukocytes, those white ones, and then thrombo or clotting cells or platelets. Erythrocytes are red blood cells. They are made in the bone marrow. They carry oxygen from the lungs to all body cells. They contain hemoglobin, which is a blood protein, which helps them have the right shape to carry the right amount of oxygen. Leukocytes are white blood cells. There are 5 different kinds of these white blood cells, and they fall into 2 major categories: granulocytes and mononuclear leukocytes. Those are the 2 major types, or 2 categories, but there's 5 different types. So let's talk about granulocytes. There are eosinophils, basophils, and neutrophils. Under mononuclear cells, there's lymphocytes and monocytes. So this is a good visual to try and remember that. So you have white blood cells, you have either granulocytes or mononuclears. The mononuclears are lymphocytes or monocytes. The granulocytes are eosinophils, basophils, and neutrophils. Thrombocytes are also known as platelets. They're clotting cells. They're tiny fragments of blood cells that are formed in the bone marrow, and they're absolutely necessary for blood clotting. But if you have too many, you end up with bloody clots, and that can be a life-threatening condition. If you have too few, you can end up bleeding out. And so you can see it's a balancing act. It's really important that that be the right amount. So this is a visual of some pictures. Looks like I might need to increase this view. Let's see if I can zoom in a bit. Yeah, that's a little bit better. Your book does a better job of showing this to you, so I'd encourage you to whip open your textbook and take a look at this in your book. But your red blood cells, you can see the shape and that sort of thing. They contain hemoglobin. They don't have a nucleus. Then you've got your leukocytes, your 5 different types. Remember, you've got your granulocytes of eosinophils, basophils, and neutrophils. You have your mononuclear cells, which are lymphocytes and monocytes. And then you have your platelets, your little thrombocytes. Okay, quick quiz. Which type of blood cells are necessary for clotting? Which ones are necessary for clotting? I know you can get this. All right, acromegaly. This is an endocrine disorder, and we'll be talking about that when we get to chapter 18. But it occurs when the pituitary gland produces an excessive amount of growth hormone after someone has completed puberty. It often results from a benign tumor of the pituitary gland. The person is typically of normal height, but their bones and soft tissues in their hands, feet, and face grow abnormally. A famous person who was believed to have acromegaly was Abraham Lincoln. Laparoscopy. This is a type of minimally invasive surgery. It's a visual examination of the abdominal cavity using a laparoscope, which is a lighted telescopic instrument. They insert the laparoscope through little tiny incisions in the abdomen near the navel. It's used to examine the abdominal viscera or organs, those internal organs, for evidence of disease or various procedures. Adenoids. Adenoids are small masses of lymphatic tissue located in the part of the pharynx near the nose and nasal passages. The literal meaning of adenoids is resembling glands. And that's appropriate because they're not endocrine or exocrine glands, but they're like them. Sometimes you'll hear of someone having a TNA, a tonsillectomy, an adenoidectomy, because they've become enlarged and block the airway from the nose to the pharynx. And that is it for chapter 3. I'll be back soon to talk to you about chapter 4. Thanks.